Hi Vikings, I'm Dr. Rebecca Demarest, pediatric and young adult sports medicine doctor at Emerge Ortho. I'm also the mom of Luke Pollock and Ryan Pollock, who play for the boys team. I wanted to take just a few minutes of your time to talk about concussions, what they are, what to look for, and how to manage them. According to the CDC, a concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head, or by a hit to the body that can cause the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. For kids and teenagers, it is normal for concussions to take up to 3 weeks to resolve, and sometimes symptoms do not show up right away, but can continue to evolve over the first few hours and days. A concussion can cause physical, cognitive, and emotional symptoms. Common signs and symptoms of concussion are presented on this slide, with headache, fatigue, balance and vision issues, difficulty concentrating, irritability, and difficulty sleeping being quite common. During practice or a game, if you have a distinct head injury or begin to experience any of these symptoms, it is safest and recommended to stop playing and tell a coach or teammate. It is best to be properly evaluated before returning to play. Symptoms and situations can worsen by returning to play too quickly. We follow the mantra, when in doubt, sit them out. Depending on the severity of your symptoms, many people can be seen by their pediatrician or sports medicine physician for evaluation within 3 days. Urgent symptoms that should prompt you to seek emergency care include, but are not limited to, loss of consciousness, worsening headache, prolonged continuous vomiting, seizure activity, neurologic deficit or weakness, neck pain, or a significant change in behavior. If you are concerned, go and get evaluated. Initial treatment focuses on cognitive and physical rest. Avoid anything causing an increase in concussion symptoms. Avoid intense cognitive activity, trying to read, or doing homework. Limit screens and excessive TV. Increase the font size on your phone to 18 and limit use to 15-minute intervals or less. Sports and any physical activity that puts you at risk for another concussion should be avoided. However, voluntary untimed walking that does not increase symptoms may actually help with recovery, so is allowed and encouraged. Stay hydrated and eat a carbohydrate and protein snack every few hours to avoid dehydration and hypoglycemia. You may be more tired, so get good sleep and keep routine bedtime and wake-up times on both school nights and weekends. Most medications do not help with concussion headaches, but avoid non-steroidal anti-inflammatories in the first 72 hours, as they can act as a mild blood thinner and worsen a potential brain bleed. You can try Tylenol, but focus on rest, hydration, and nutrition. Make sure to talk with your coach and athletic director if you experience a concussion. Follow up with your pediatrician or sports medicine physician for proper evaluation of your head injury. They can help guide you with how and when to return to school, activities, and sports by creating return to learn and return to play plans when they are appropriate. For emergencies, call 911 and proceed to your local emergency room. For non-emergent injuries, please feel free to call our Emerge Ortho Sports Hotline at 910-520-3741, where a licensed athletic trainer can help triage any injuries, answer questions, and assist with appointments. That's it. Have a great and safe season. Go Vikings!